I want to talk a little bit about our nursing homes and long-term care facilities, because at the very beginning of the pandemic, it was very clear that there was a lot of distress. We received multiple messages from many people in the community who were, family members of those who were there, from staff, who were all concerned about outbreaks and the control of those outbreaks at our nursing care facilities and long-term care facilities. And some of the challenges with the infection rates, as well as with staff just being there because they may be infected or at risk of being infected. And so I'm wondering, during an outbreak at one of these facilities, what is the state's process when it comes to response team? And then in addition to that, how long does that response team stay? And if the actual outbreak is due to some sort of violation, or there have been multiple violations, how did we come up with the fine number? And then do we notify the family members or the folks who are responsible for those individuals in those settings? Do we let them know that there's been something so serious that's happened at the facility that you have imposed a fine?
So let me take that question, and I do apologize that we are not able to stay on for longer, and hope to be able to continue the conversation later. But so when there is an outbreak at a facility, actually the very first and front line are the local health departments. And so again, I would emphasize that our local health departments are really, they've been at the front line of the pandemic response, since the very beginning. And so there usually is an interaction with the local health department, their communicable disease staff who work with the long-term care, the nursing homes or whoever. And really many of them have strong relationships with the nursing homes built over many years. And so they work with them to understand what the nature of the outbreak is, where it might be located, and to provide some initial feedback and advice on cohorting of staff and of residents to try to prevent ongoing spread. So that's important. In addition, they work very closely with the Maryland Department of Health, not only for COVID, but with any outbreak. We have our own outbreak team that oversees and provides guidance to all local health department communicable disease teams, whether the outbreak is in a nursing home or in another location, but certainly in nursing homes, we know has been the biggest impact when we've looked at and seen the COVID-19 pandemic. And so our team as well at the health department, the state health department, have infection control nurses and experts who also work with not only the local health, but even directly with each of the nursing homes during outbreak settings, particularly those that the local health are asking questions about, or feel collectively with the nursing home administrator that they need more assistance. So that has been ongoing since the very beginning. In addition, the state, of course, had stood up teams working with the National Guard, as well as federal Health and Human Services teams that deployed out in the spring to do testing and assessments. And more recently, in the early part of the fall, we stood up our technical assistance teams, or congregate living teams, that has evolved over time to provide additional technical assistance to oversee and help to monitor and really try to be a partner with our nursing homes to look at PPE supplies, look at advise on infection control practices and such, not only in outbreak settings, but also really to try to prevent outbreaks from happening. And so that's important as well, so that we have outbreak response, but also prevention of outbreaks. And they've been using a list to ensure infection control, PPE supplies, adequacy, and other things. And if there is a need, and there has been at times, and this came up more frequently in the spring, where because of an outbreak there and because of the need to then quarantine staff, that there are facilities who've been short-staffed. We've been working very closely with our nursing home associations and our hospital partners to find alternate solutions for staffing to make sure that residents are still taken care of. But in the event that there is a need for staffing, these technical assistance teams or the congregate living teams have been able to fill in for 48 to 72 hours as almost like a bridge, if you will, until more permanent staff or additional staff can be brought to bear, or until the staff who are in quarantine are able to come back to work. So that's been critically important. In terms of the fines and such, OHCQ, or Office for Healthcare Quality, conducts and has been conducting since the spring very targeted, as required by CMS, focused infection control surveys. And they've actually done nearly 500 of these surveys across the state in each of our 227 nursing homes. And as you can tell from the numbers, in some nursing homes, it's been more than once. And so that's been since the spring. And they have, they are going after and trying to identify the same issues I think we're all concerned about. Now, the nursing home itself, should be providing that information about any citations or any fines that might be issued as well, and providing that information to the families of the residents that they serve. And so any statements of deficiencies and such, once we have vetted them, because, again, this is, we do make them public, but usually after the investigation and such is more thoroughly vetted with the facility and a response and such. So we work with the facility even when a deficiency is found, especially when a deficiency is found.